Good day, my fellow nurses. For today's video, we're gonna talk about the delivery case of Mrs. Torres. So stay tuned for the questions, for the answers, and additional information that this video will cover. Once again, I am Corbin and I'll be your nurse for today. The situation goes like this. Upon admission, Mrs. Torres, admitted 4 hours ago, is a 28-year-old Gravita 3 para 1011 married woman whose expected date of delivery is today. Upon assessment, lab examinations revealed normal level. This implies that Mrs. Torres' pre-pregnancy weight was 140 pounds, weight gain of 40. Next, her baseline blood pressure was 110/64. BP remained 110 to 120 and 64 to 70 throughout her pregnancy. According to the report an hour ago, she remained healthy and active. Medication are ferrous sulfate, multivitamin, and folic acid daily. Mrs. Torres' cervix was dilated to 6 cm and 80% effaced at 0 station. The baby's position is also in ROA, or right occiput anterior. There is also a spontaneous rupture of membranes occurred at home 6 hours ago. The fluid was clear. Mrs. Torres is having a strong contractions every 2 minutes, lasting every 60 seconds. Next, we have the fetal tone of 140 to 150 with good variability. And lastly, she has an IVF of D5LR in her right arm. As for the vital signs, we have the blood pressure of 122/72 mmHg, temperature of 99.8 degrees Fahrenheit, and heart and respiratory rate of 90 and 20 BPM respectively. During labor, the nurse prepares to meet her patient and do an assessment. The nurse recalls that the last exam was an hour ago. Mrs. Torres was only 6 centimeters dilated and only 80% effaced. She had planned to ask Mrs. Torres how long her labor was with her son, but now is concerned that this labor may be progressing more quickly. Mrs. Torres is now completely dilated and she has been pushing for 10 minutes. The baby was crowning. The fetal heart tone are dropping from 90 BPM from a 140 BPM baseline with each contractions. Mrs. Melanie or Mrs. Torres delivers a baby boy who is immediately placed on her abdomen for skin-to-skin contact. His Apgar scores were 8 and at 1 minute and 9 at 5 minutes. The doctor waited for 10 minutes for placenta to be delivered intact. Finally, episiotomy was done, and then the nurse have rendered postnatal care to Mrs. Torres before transferring to her ward. Now that the situation is now on the way, let's go to the activity questions. So the first question is that, what is the actual stage of labor? The actual stage, or also known as the active stage of labor, started when the patient was recorded to be at 6 centimeters dilated and 80% effaced. This is then followed by the record taken an hour after. The record stated that the patient was fully dilated and pushed for 10 minutes. The baby was then in crowning position while his heart rate drops from 140 BPM to 90 BPM. Finally, the actual stage ended with the patient undergoing episiotomy and had been transferred to a ward after a postnatal care. Next, how does a nurse prepare for a routine delivery? So according to cron.com, during a routine delivery, a labor and delivery nurse assists the physician by anticipating the needs for supply and equipment, encouraging the patient, administering medicine, and attending to the baby after birth. Since each birth is unique, a labor and delivery nurse must be ready for anything. Occasionally, a precipitous or a sudden labor acceleration may require a labor and delivery nurse to deliver the baby without the physician present. In the event of any emergency, a labor and delivery nurse must be fast-acting. So for the next question, what does a nurse need to know about pain management at this point of labor? So according to Newton Wellesley Hospital, During the actual or the active stage of labor, comfort measures that provide natural relief can be very effective during labor and childbirth. Birthing techniques such as hydrotherapy, hypnobirthing, pattern breathing, relaxation, and visualization can increase the production of endogenous endorphins that binds to receptors in the brain for pain relief. Other methods of comfort therapy such as effleurage or the light rhythmic stroking of the abdomen, massage, emptying of the bladder, and hydrotherapy as stated can provide pain relief and reduce the need for narcotic analgesia or anesthesia by naturally creating competing impulses in the central nervous system that can prevent the painful stimulation of labor contractions from reaching to the brain. For the fourth question, how do we document her labor progress? By carefully recording the patient dilation along with effacement, partner with fetal heart rate and its position. A nurse should be able to accurately assess the situation of the patient. Additionally, consistent recording of vital signs is required. For the fifth question, what are the signs of placental separation? So referencing with the list provided by Mayo Clinic, placental separation can be assessed using the following. First, vaginal bleeding. Second, abdominal pain. Third, back pain. Fourth, uterine tenderness or rigidity. And fifth, uterine contraction, often coming one right after the other. So for the sixth question, what are the indications of episiotomy and nursing implication for nursing teaching? Referencing the study of Saadia, the indications of episiotomy included forceps delivery, in concerns with FHR, venous delivery, vaginal breach, face to pubes, previous history of perineal care, maternal exhaustion, rigid perineum, good size of the baby, along with other health and safety benefits brought by episiotomy. In accordance to this, the patient teaching should be focused on the benefits, procedures, and safety warnings of episiotomy. Potential risk should also be included. Next question. The doctor ordered a methergine 1 IM. What is the initial action of us, nurses, should do prior to administering this medication? As a rule of thumb, assessing the allergic reaction is a top priority in giving any medication. Additionally, by interviewing the patient, drugs that are previously taken by the patient should also be recorded. This is due to the risk of having a drug-to-drug interaction that can compromise the health and well-being of the patient. Previous diseases and pain should also be assessed and recorded. Diseases in kidneys, liver, high blood pressure, diabetes, high cholesterol, and etc. are needed to be recorded before administration. Finally, it is noteworthy that the medication may decrease the amount of breast milk. Methylligonovine or methergine passes into breast milk in small amounts and may have undesirable effect on the nursing infant. Consult the doctor before breastfeeding. And for the eighth question, this is one of the most essential information that we needed to memorize. So the question asks, what is the estimated blood loss for a normal vaginal delivery? So the average amount of blood loss after birth of a single baby in vaginal delivery is about 500 ml or about a half of a quart. The average amount of blood loss for a cesarean birth occasionally or approximately around 1000 ml or 1 quart. Most postpartum hemorrhage occur right after delivery, but it can occur later as well. And for the ninth question, what patient teaching will Mrs. Torres need before she is discharged? Patient teaching should be focused on providing self-care and comfort along with postpartum activities. Self-care includes doing sitz bath and exercises. With monitoring, the nutrition should also be addressed. Finally, knowledge on postpartum activities such as breastfeeding and proper skin-to-skin contact may also be needed to teach and or enrich and expanded. And for the final question, what information should the nurse give to Mrs. Torres regarding a follow-up care for herself and for her baby. So first, teaching the patient on proper assessment on the situation, the risk of having a complication can be reduced. Also, it is then important to discuss the significance of complying the scheduled checkups to further induce the recovery of the patient. Additionally, by giving, enriching, and expanding the knowledge of the mother towards caring for her child, collaborative interventions will be effective, thus securing a safe, happy, and secured postpartum period. I hope that you've learned something for today. The nursing care plan and then the drug study can be downloaded down below. And for more content like this, make sure to click that subscribe button and ring that notification bell. Once again, I am Corbin and I'll see you in the next video. Stay sharp and stay smart.